You know, a lot of people suffer from depression. You don't even realize it. Could be, a friend, a loved one, or whatever, or yourself. What do you do? Well, Gulf Coast Neurospa has a depression treatment center, actually 2 of them here on the Mississippi Gulf Coast. The one we are at today on Lorraine Road in Gulfport, or there's also one on Government Street in Ocean Springs. Liz Bush, who is the Director of Market Development and Education. We're speaking to her right now. Liz, how are you?
I'm good. How are you today?
I'm very well, thank you. Tell us a little bit, if you would first, about Gulf Coast Neurospa and the different types of services that they do have.
Sure, absolutely. First of all, welcome.
Thank you.
We established in 2020, and we have 2 locations, just as you just mentioned. So we're able to serve patients all along the Mississippi Gulf Coast, which we really love, have a passion for. So there's a multitude of services that we have here. The first one is going to be TMS. We use a cloud TMS machine, which is an FDA-approved device for treatment-resistant depression and obsessive-compulsive disorder. So that's wonderful. The second one that we offer is called Spravato. It's actually a nasal spray for treatment-resistant depression, which sounds kind of novel, and it really is, but it's a great option for patients. The third one is massage therapy, and insurance actually covers a lot of these services. So if someone you know is suffering and needs to be evaluated, please send them, our way.
Because that's one thing that so many people do suffer from depression, you don't even realize it.
Correct.
I mean, you can look at this person and they might seem like the happiest person in the world. I mean, look at Robin Williams.
Yeah.
One of the greatest comedians in the world, suffered from depression and some other things too, and took his own life. I mean, no telling what some treatment like this could have done for him.
Absolutely.
And people deal with that on a daily basis.
And that's really what we focus on, is treatment-resistant depression. So patients that maybe have tried and failed other medications in the past and they're not getting to where they want to be, we really want to help that population.
All right, well, we're going to go back into one of the treatment rooms and find out more about Spravato here at Gulf Coast Neurospa. So tell us about, the patient comes in, tell us the steps they go through.
Sure. So we actually have Dr. Brian Viverberg, who's our board-certified psychiatrist here, and Scott Turner, who's one of our registered nurse practitioners. He's wonderful as well. But a patient will come into our clinic, and they get a comprehensive exam from Dr. Viverberg, head to toe, kind of looking at patient history, comorbidities, maybe anything that would inhibit a patient from getting any of the treatments that we offer. He kind of looks at it at a whole picture. Then from that point, he decides what treatment option is going to be best for the patient, what they're experiencing, their disease states, and things like that. So at that point, they would decide which avenue to go with, and we would get the patient approved with insurance and started.
And that's another great thing, as you mentioned before, that insurance does approve this.
Yes, we actually have incredible insurance coverage. Every day we're adding new payers to the services that we offer, and the VA actually covers all of our services at no out-of-pocket cost to patients.
That's awesome.
Yeah,
That's
it's wonderful
awesome.
for the veterans.
The veterans could definitely benefit from this.
Yeah, absolutely. Especially after everything they've done for our country, to have them taken care of.
Yes. So, Spravato.
Yes.
Tell us about it.
Well, first of all, this is a training nasal spray, but for all intents and purposes, this is Spravato. Just to show you what it looks like, it's a nasal spray delivery system for treatment-resistant depression. So patients would actually come in, and this is just like any other nasal spray delivery system.
Right.
They would do 1 spray in each nostril, and then we would monitor the patient's vital signs as soon as they come to the clinic for the treatment, 40 minutes in, and then at the 2-hour mark. Now, Spravato, can raise blood pressure or heart rate, so we are very cognizant of that and have a 1-to-1 with the patients. Now, on our Spravato treatment side, every patient has their own private room with a chair just like this, a setup essentially just like this.
This is very relaxing.
It's very nice. We try to cater to our patients. We really care about them.
So they got suckers?
Yes, so we have the suckers to help combat, anytime you use a nasal spray, you get a little drip in the back of your throat, kind of a nasty taste. So just to help combat that, we also have noise-canceling phones. We also have Spravato brochures in case they want to read a little bit about the treatment that they're having. Blankets, pillows, everybody's got their private area, which is really nice. So they're going to be here for 2 hours, then come and take a nap. Yeah, absolutely.
Then you have a nurse that comes in, or a tech that comes in and checks on them, as you said, their vital signs.
Yes.
Because that's kind of important, because everybody's going to react differently, I'm sure.
Absolutely. So we have a 1-to-1 with these patients. We make sure that they're taken care of before we discharge them from the clinic. And this treatment is only twice a week, whereas the TMS that we discussed earlier is going to be every day, 5 days a week.
So what is exactly the active ingredient in Spravato?
So it is actually a molecule of ketamine. It's called S-ketamine, and it is the only FDA-approved molecule of ketamine for treatment-resistant depression and depression with suicidal ideation.
You know, that's another thing that a lot of veterans have to deal with is suicidal thoughts, things like that. I mean, the average person does too, but not as much as they do, considering what the service they've done for our country.
Correct.
And the able to come back and another thing, do this. And the fact that the VA, it's covered.
It's so covered, yeah. And what's really great too is not humble brag on Dr. Viverberg. He's a retired colonel.
And
And
Air Force.
Yes,
Yes,
he's got a
wonderful guy.
passion for veterans, and so we really want to take care of the VA patients.
Definitely. So again, if someone wants to, if they're dealing with depression, depression with suicidal tendencies, they could come to either location, where you are here on Lorraine Road, close to the Pink Flamingo, I believe it is.
Yes,
Okay, and then the other one is on Government Street in Ocean Springs.
downtown.
Downtown. They can call the number on the screen, set up an appointment, and whenever you come in, that's when you go through an evaluation.
Absolutely.
So everybody's going to be different as to how long the treatment is going to be, and how you see that it takes effect on them.
Yes, and we want patients to be treated individually. You know, this is not a one-size-fits-all treatment at all for anybody that's suffering with depression or obsessive-compulsive disorder. We want to treat everybody individually. So
Now, we've talked about in the past the TMS
yes.
and this. Is there a specific difference as far as the treatments? Who would be a great candidate for the treatments?
Absolutely. So again, with the intake process that we have with Dr. Viverberg, he's going to go over the entire patient, his medical history, pharmacologic history, any kind of indications that the patient wouldn't be right. Like, for example, TMS, if you have a metal plate in your head, you would probably not be a great candidate for it.
Pardon the pun, you read my mind. Because I was about to say, if you had or a bullet fragment or something like that, or metal in your teeth.
Correct.
You would
History of seizures, that's another one. So we take a very individualized approach to our treatment. So he's going to look at all of that and decide which avenue to go with for the patient.
So either way, you have two great treatment plans here. If you suffer from depression linked to suicide possibilities, these are, you can come in and find out which one would be perfect for you.
Absolutely.
And I mean that's great right there that you can get some help with this. Liz, thank you so much.
It's been a pleasure.
Appreciate it. It's been a pleasure here. Again, there's two locations here on Lorraine Road in Gulfport or on Government Street in Ocean Springs. If you want to get some treatment, Gulf Coast Neurospa, they have different things here. They got a great massage therapist as well. So if you want to set up a massage therapist. Anyway, Gulf Coast Neurospa, Ocean Springs, and Gulfport.